Welcome to our Activate Your Impact Nonprofit Policy Webinar Summit. Hi, I'm Kira Kazantzis. I'm the CEO of Silicon Valley Council of Nonprofits, and I'm so glad you're here with us today. We're all having lunch together as we hear about housing, health, and food as medicine. This is our second webinar in the Activate Your Impact Nonprofit Policy Webinar Summit series. And you may ask, why are we here talking about policy in the middle of a global pandemic? Obviously, nonprofit organizations already do so much in our community, especially in great times of need like now. And it's also important that every nonprofit uses its voice, our voice, to lift up community voices, to bring lasting positive change for the community we serve. We at SVCN believe that advocacy is a sacred duty of nonprofits, and it should also be a core competency. So we're here to help you advance your mission, secure needed resources, and work with you to build an equitable and thriving community together. I should say we're super grateful to our sponsors for sticking with us as we pivoted from our in-person summit to our 5-webinar series, and I will thank them now. Palo Alto Medical Foundation, Sutter Health, Applied Materials Foundation, El Camino Health, the Health Trust, Housing Authority Santa Clara County, Santa Clara Family Health Plan, SV at Home, and Valley Medical Center Foundation. Thanks, folks, for sticking with us. Of course, we wish we were all here together in person so we could interact with each other, but we're going to do our best to interact and to answer your questions and capture ideas. I can't see all of you, but I did bring my lunch, and I'm going to be listening together with you. This is a avocado sandwich and some type of dip. Hope you are able to take a break while you listen. You keep your brain active and fill your belly while we listen to this great talk. My colleague Jen Tarai, who's our Director of Learning and Membership Engagement, is going to intro our panel.
Thank you so much, Kira, and hello, everybody. Thank you all for joining us today. I will go over a few logistics before we get started. If you are not yet familiar with the Q&A function on Zoom, you can look at, I think it's on the bottom of your screen. It's a little icon that's got 2 talking bubbles, and you can click on that. That is where you will enter your questions for our panel. Those questions are going to be answered within like a thread. So you'll see as it pops up that we'll be able to provide you with the answers to all of your questions within this webinar. And I will also send out that list of questions and answers afterward so that you have the information to take home with you. I will also send you all an evaluation. So at the end of this webinar, once you're ready to leave the Zoom, there will be a little pop-up window that'll ask if you want to be sent to this link. Please click yes. It's a Survey Monkey with our evaluation questions. As many of you know, I always take these evaluations very seriously, so I urge you to please fill it out and let us know what you think about today's session. And again, I said that I will send a follow-up email. So we will provide you with the questions and answers. We are recording today's session, and at some point we'll be able to share the recording with you. I can't promise when, but it'll get sent out to you. Let's see. The next thing I wanted to let you all know about is that today's session is a part of the Affordable Housing Month. Let's see, I'm trying to queue up the slide here. Give me 1 second. And I want to introduce Kriti Garg from SV at Home, who will tell you a little bit about, sorry, Kriti, I was getting your slide ready, but she'll tell you a little bit about Affordable Housing Month and the Coalition of Housers.
Thank you, Jen. SV at Home is so excited to be partnering with SVCN and the Health Trust today to host the event, which is part of over 50 events and activities taking place throughout Affordable Housing Month. During Affordable Housing Month, we dive deep into both our housing challenges and the solutions that we are building together. The central message is that everyone deserves access to a safe, stable, and affordable home, and that message is more relevant now than ever before. We still have a few events remaining this week, including a webinar on affordable housing state legislation, a virtual story time with the public library for kids, and an expert panel like today's on the intersection of housing with education. You can check out our website, siliconvalleyathome.org, for more events, as well as recordings of events from the past few weeks. This program is also presented in partnership with the Coalition of Housers, or COHO, a new network for emerging leaders in the South Bay affordable housing industry. As the need for affordable housing grows, so does the need for supporting the leadership and professional development of a diverse community of housing advocates. COHO members collaborate with peers and experts, build skills and knowledge through workshops and trainings, deepen civic engagement, and lead projects. For more information and to sign up for the COHO newsletter, please visit SiliconValleyAtHome.org. And I'll pass it back to Jen. Thank you.
Thank you, Krithi. And just so you all know, I will also share those links in our follow-up email after today's session. One more piece of housekeeping, because Gabby reminded me that the chat function is not enabled for this session. So if you do send anything in chat, that is just going to go to panelists, just so you're all aware. All right, so I think that we are ready to get started. And I want to give you a little bit of background before I introduce our moderator for today. In November, SVCN did a member survey. So we wanted to find out what all of you are interested in having us support you with. And over 70% of our respondents said that you want SVCN to become more engaged in housing policy. So today we're going to be talking about housing as good medicine. And I want to dive right into the topic. So on that note, I want to introduce Michele Liu, who is the CEO of the Health Trust. And the Health Trust is an organization that is working to build health equity for all. So go ahead and take it away, Michele.
Thank you, Jen, and thanks to everyone at SVCN for organizing today's lunchtime talk. I did bring my lunch too, like Kira did, but I am not going to eat lasagna on camera for the good of all of us. But I did wear a necklace today for the first time in like 2 months, so please know how special you all are to me. I want to dive right in with our incredible panel of people. Today we have Dante Lartigue, who's the CEO and co-founder of Raising the Bar. We have Keely, the director of the County Office of Supportive Housing, and Jen Loving, CEO of Destination Home. As you heard from Kira, today's panel focuses on advocacy and the theme of housing as good medicine. I want to start off our conversation by asking Dante to tell us a little bit about his life experience that has led him to becoming the advocate he is today. Dante?
Hello, again, I'm Dante Lartigue. The reason I do the work I do, I was a product of public systems. I grew up in foster care. Prior to that, living with my biological mother, she was on GA as long as I could remember, general assistance. And so I've always been involved in public programs, whether it was through school or county agencies. And for me, I think growing up in foster care, not right away, but really in my later teen years, I started to notice a lot of inequalities that, I faced just being a young man of color, growing up in foster care. And I saw that people, even though I had behavioral issues and a lot of times I was just looking for love, but I didn't know how to really show that, when I'm bouncing from home to home. But I think when I was about 16, 17 years old, I realized that the system didn't treat me the same way they treated my white counterparts, the white young men and women that were growing up in foster care. And I felt like the system in many ways was afraid of me, and they didn't know how to approach me to serve me. And that changed when, I was being served by a local nonprofit. They used to be called, they're called Uplift Family Services now, but they used to be called EMQ, Eastfield Minkwang. And I had a mentor family specialist that was a man of color that really treated me as a child and gave me the love and nurturing that I needed, but also was able to be real with me and say, hey, look, keep going down this path. You'll you'll end up in prison in the penal system. And you know, I didn't want that, but for me, he was the first person, and it took years. He was the first person for as long as I've been in care to really show me that he wasn't really afraid of me and that he saw me as a person. And through that process, I realized that a lot of kids didn't have that, especially kids of color. And I wanted to change, you know, I wanted to change that. I wanted kids to, you know, not be able to meet someone and feel that fear, you know, and feel that discomfort of people not liking them or judging them. And so when I was about 19 years old, right before my 19th birthday, I got approached by the county Department of Family and Children Services to help create and found a youth center for current and former foster youth, and it's called the Hub. And I kind of fought them off a little bit about it, but they knew I was connected to youth. I was a downtown kid, and that wasn't necessarily a good thing, but I was connected to most foster youth, juvenile hall, probation youth that hung out downtown. And they basically came to me, my LP case manager, and said, I think you would be a good role model for these kids. If you change your life, I think they would follow. And I heeded that advice and took that advice after a couple of weeks and decided to start the center. However, what I realized is we were very quickly, I realized we were understaffed. We didn't have the resources and really the human resources, people. We didn't have people in place to serve youth at the level that we needed to. And so I started advocating for that. You know, I started voicing my opinion on that. I advocated for the Department of Family and Children Services that work strictly with foster youth and non-minor dependents to decrease the caseloads of social workers because they were swamped. They had 40 to 60 kids per caseloads, and they weren't spending a lot of time with young teenage children, young adults. And that's just, for me, a recipe for disaster. It's just not a good, recipe. And so I did that for a few years, and I really didn't see a lot of change in the system in that approach. And so in 2017, I started raising the bar in January of 2017 in the hopes that I could create a model that would address some of the inequities that youth faced, especially youth of color. And I wanted to be able to create a model that was a very small caseload. So our caseload is 10 to 1. With that being said, we did that purposely. I was on the Joint Foster Youth Task Force with Supervisor Cindy Chavez, and I was privy to information, and that information said that our social workers and case managers were swamped with youth, and they didn't spend a lot of time. And I wanted to change that, so we intentionally created a model that would focus on small caseloads and building relationships, and we coupled that with housing. Housing kind of fell in our laps. We were essentially going to just support youth in getting housing, but a local real estate investor, believed in what we were trying to do and offered us a home, and that was our first home. Now we have 2 properties, and we were able to receive our first grant from the county. Last year, we essentially got it in 2019. We received the funds in October of 2019, and so we've kind of been hitting the ground running. But yeah, for me, advocacy looks like simply just speaking up for those that don't have the voice, and also making sure that while you're doing that, you're educating them to learn how to have a voice and really speak up to things that matter to them, and look for equality in everything that they do, whether it's their career, their community, their housing, because I know emancipating out of foster care, one of my biggest hurdles was I didn't have credit. No foster youth coming out of foster care has credit, nor rental history, or an adequate enough income to be able to survive here. Even with 5 roommates, no one was trying to give me the time of day. I applied to 30, 40 apartment complexes, but I think one of the real things were I was also a young Black male, and I learned to stop telling people this, but I used to tell people I'm a foster youth, and there was this stigma, and I learned that quickly. Me and my wife at the time, my girlfriend, we didn't know each other at the time that I applied to an apartment, I didn't get into that apartment. They told me it was going to take 2 years. 6 months later, I came back with my, not even 6 months, probably about 5 months later, 4 or 5 months later, I came back with my, my girlfriend, who is an Asian woman, and we got into that apartment literally in 3 weeks. They told us it would be about a 3 to 6 month wait, but we got in 3 weeks at the same apartment complex. And I realized that some people saw my Black skin as a weapon. They saw it as something that was like tainted, and it just bothered me. And for me, that's what I do. A lot of the work I do it for young people of color that don't know how to advocate for themselves, that society sees as a threat. And I don't think we talk about that enough, but I think that also manifests in young people because they can feel it, and they end up turning to the streets, or they turn to negativity, and it leads them to be incarcerated at high rates. And so for me, it's just breaking down those barriers and educating people on both sides of it, young people and people in the community, people that work, you know, in the community itself.
Wow, Dante, thank you. I feel like we could end the webinar right now, and we have all gained a lot in a short time. However, we have other awesome people. I want to turn next to Jen Loving, who's had a different experience, but is known as one of the fiercest advocates in the county. Jen, how do you approach advocacy, and how do you weave in experiences like Dante's into your work?
Hey, Michelle, and thanks SVCN for having us today. It's such an honor to be a part of this, so thank you for including me. You know, I would say that the reality is our sector hasn't done a good enough job. I think having leadership come from people with lived experience, you know, and also having enough of an equity lens. And so, you know, Destination Home has been working for the last few years on a couple of efforts that have really helped to hopefully shift the leadership and decision making from sort of the way that things have always been done. One of the things that we did, and Dante's one of the founding members, is we formed a lived experience or a lived expertise advisory board for our continuum of care. Our continuum of care is the broad network of agencies that are all working together on housing and homelessness. And we all do that under one united community plan to end homelessness. And that has been a real game changer for our sector. It's a public-private partnership. It's a set of discrete strategies that includes advocacy. And so this lived experience advisory board was created a couple of years ago. They are hosted by our continuum of care, and they weigh in topics. People come for policy decisions like how to spend the state HAP money. There was, you know, weighing in on how to roll out policies. And then even now during COVID, I mean, frankly, our board members are on the front lines distributing supplies. They're serving meals in the homeless camps 3 times a week. They have a standing call with the office or with the Emergency Operations Center during the pandemic every week to know how they're providing their leadership, right, in terms of helping to provide an emergency response. And so that's one thing. But the other thing I think that is a challenge for all of us is how do we also include that lived expertise on our boards, on our actual boards of directors. And we are at Destination Home, we have added, we have 3 members that have lived experience. We're actually super excited. Dante's joining our board next month. We're so lucky. But that expertise is really important. And so, you know, for me, I ask every time I'm asked to do a panel, I ask if I'm making sure someone who has actual lived expertise with homelessness is doing that panel with us, because we need to make sure that the policies, the solutions, things are being crafted with people that know whether or not they're going to work, you know, and you know, take the UBI foster care pilot that's happening, which is amazing, right? Dante's been front and center on that work, because we have way too many times, I think, set things up that doesn't actually solve the intended problem. And so the more that we're willing to have a table that is led with, whether that's our staff, whether that's our board. I think the biggest challenge for all of us going forward is how all of our organizations are approaching this work with a racial equity lens, and are using DEI like lens when we're recruiting and we're adding to our staff and our boards, and making real clear commitments of what that means. And so, because otherwise we're going to keep repeating mistakes, I think, that we have made historically that has gotten us into a society that has an overrepresentation of people of color in homelessness, that has an over-concentrated poverty in discrete areas, that these issues have been created by a supremacist, right, system, right, that has to change. And how do we change that if not by being deliberate within every part of all of our organizations?
Jen, I can see you and Dante doing a future SVCN webinar on how to build boards with lived experience. I think a lot of us, the Health Trust included, we're a little nervous about that, but you're showing that it can be done.
You know, it's, I mean, we've made that commitment on our staff and on our board, because well, part of it is for us to talk about it, we have to do it first, right? And so we've been making that commitment to do that work first. You know, the criticism that I think that is fair is setting up boards of whether it's a consumer advisory group or a lived experience board or organizing groups that are not that are adjacent maybe, right, to our boards, is not maybe good enough, you know? And so how do we really, if we want to speak truth to power, what does that really mean? Task forces and advisory councils and things are set up all the time to solve for vulnerable populations without anybody who's experienced any of those vulnerabilities or discriminations or inequities being part of the conversation. And so that is something that I think is critical that we change in light of the recent murders and executions of people of color, all the way down to where we're having concentrations of people that are testing positive for COVID.
Jen, you talked about speaking truth to power, and I think in the housing world, Keely is power. I think oftentimes our focus of advocacy is the county, but we have all seen that Key has been a fierce, successful advocate himself. And so Key, tell us what advocacy looks like and means to you.
Thanks, Michelle. Thanks, everybody, for having me here at the Emergency Operations Center. So that's why I have this mask on and this handsome vest. You know, I really think that there's actually quite a few of us doing this work. I'm really proud of what the county's been able to do and what all of us have been able to do. And I think the reason I'm proud of what we're being able to do is because, you know, the county is mainly made up of people who want to help. You know, they're helpers, doctors, social workers, things like that. And, you know, advocacy to me, or in this context, is really about, we all want to change the world. I mean, we want to make it better. We want to fix it, quote unquote. And it's going to take a lot of time, and we have to sort of do it together. I mean, everyone in the Office of Supportive Housing, many of them, you know, were on the front lines, including myself, running shelters, running outreach programs. More than anything, we want to change the policies and programs that that are pushing people into homelessness, pushing people into poverty, and keeping them there. And the key is, I think, how do we sort of do it together? You know, Jen and I work closely together. We work closely with the city of San Jose. I don't think that we agree on everything, but when I go talk to the city of San Jose Housing Department, I'm not advocating for something. I'm saying, hey, look, this is what I think could be done. Maybe we agree, maybe we move forward on some of it, and then maybe next year we move on some of it later. And to be honest, whenever I talk to Dante or Home First or NAMI, you know, everything that people are telling me, I love it. I'm like, let's try to do that. I want to do that, but it's how can we sort of do that and balance other needs in the time and in the context that we have. So.
Key, since you're wearing the spiffy vest in this context of COVID-19, what are you seeing in the housing system of care that's becoming even more glaringly important for us to tackle?
You know, I think one insight that I gained was that there are very few people on the front lines doing the work. You know, people ask us, why can't you just open up new shelters or fill up motel rooms or, you know, do X? Some of it's money, you know, some of it's willingness, like not all motel owners want to allow homeless people in them, you know. But a lot of it too is when we went to Home First to open up new shelters or Life News, they said, well, we don't have enough people. We got to hire new people. We got to bring some on board. There's not enough social workers, case managers, medical social workers. So we need to really expand that type of workforce and hopefully infuse that workforce with people with lived experience.
Dante, from your vantage point, what are you seeing as glaringly important in this COVID-19 era?
From an organizational standpoint, we're very new, we're very small, really connecting and, you know, partnering with agencies that have, you know, same vision and, you know, values around supporting, you know, the most at-risk people in our communities, whether they're young people or senior citizens, and doing that. And so, you know, the work that I do with Destination Home and the work that I do with other agencies is important. I think for me, being so small and we have a very small budget, one of the things that we realized really quick, we didn't know when it was going to happen, is that most of our young people worked in the food industry or like service industry, and they were going to lose their jobs. And they lost their jobs pretty much within a month. All of our youth that we house, we have non-housed youth and housed youth. All of our housed youth lost their jobs, essentially. They were laid off or furloughed or whatnot. And just going through that process to get them their unemployment and knowing that there were going to be problems with that, just going through systems, you know, services, you know, trying to, you know, make sure that they're okay. And then us having a budget that was fixed for the fiscal year and having to adapt. That was challenging for us. You know, I at one point thought we were gonna have to, there's only 3 of us, but I was looking into basically us becoming unemployed and just volunteering and us having to file for unemployment because we didn't know if our budget was gonna stretch. And so we were lucky able to get some emergency funding and a lot of community support. We've actually got more community support during this pandemic than we've have tenfold, essentially. We've raised more money in this last 3 months than we've raised in the last 2 years just from the community. From a personal standpoint, I have a personal Facebook just for former and current foster youth of Santa Clara County, and just seeing some of the stuff that they're going through, it's like they're falling through the cracks. You know, some of them might have just turned 25 and they no longer qualify for foster youth services, but it's just like, okay, how can I connect them to other agencies like Home First or whoever, Catholic Charities or Sacred Heart for services, because when they emancipate or they exhaust all their resources, they don't really think, oh, there are other agencies that can help me, and so just connecting them to those resources has been something that I've been helping them with because it's been challenging. Even though they're not our youth or whatnot, I still see them as family. They're a part of my extended family, and my goal is to make sure that they're served. And I know a lot of people have had issues with housing, and so just supporting people with some rental assistance or connecting them to agencies that can help do that is been vital for us. But yeah, I've been seeing young people complaining really more or less about their unemployment and getting those funds. I'm working with a young man right now he's having a hard time, and we finally just got his unemployment, but it's been 2 months and we've been floating him for all of his bills because he literally lost 100% of his income. And even though he applied for unemployment, like really right when this all happened, nothing went through. He was having so many problems, and so we just figured it out. But we're seeing stuff like that. I know a young lady that had housing here. She didn't really know her rights. Nothing was really out in the news right away, but she lost her job literally like 2 days after this all started. And she had to relocate to Alameda County to Oakland because she couldn't afford her rent any longer here. And she really didn't know her rights, but I saw it, I caught it late. She was already in Oakland, Alameda County, and she lost her housing and all of her resources here because she didn't really know how to navigate. And so just seeing those type of things and trying to reach out to young people. Know a young lady at San Jose State just graduated, and all of her roommates, basically, the parents couldn't afford to pay the rent anymore, so they all had to go back home, and she's stuck in almost a $4,000 two-bedroom apartment. And just trying to navigate. She doesn't have a cosigner, so that's kind of what we do is we master lease, and so trying to help her go through that and navigate so she doesn't lose that. And she's also starting her master's in literally a few, in 8 weeks or so. And so that could be very stressful for a young lady that comes from a system like this, and it can be very discouraging, and it can derail. And so if you don't have the support, it can be catastrophic. And so just trying to fit in with the small budget that we do, trying to do the best work we can do, Yeah.
Dante, I so appreciate that. I feel like even for probably many of the people on this webinar who do case management full-time or work in the sector full-time, navigating the system or the set of systems is so confusing. Yeah, even when you're not under stress.
And I'll say that as well. A lot of our young people, essentially, keeping the social distance, rules into effect. We're very, very, Brian Stevenson has become one of my favorite people of all times. And the reason why is he spoke so much truth to me when he spoke on this panel, and I didn't know the words at the time, essentially, but being proximate is what I'm all about. Being close to the people that I serve is what I'm all about. And so we have community dinners with our young people every Wednesday and every Sunday. And that has been challenging for the first month of this. We didn't really know how to go about it. And we couldn't really do that because being in a home, being close, but we still provided them food. We still try to do as much as we could. And then when all the restrictions and regulations came out, we just try to abide by it as much as possible. I have a weak immune system. My wife has a weak immune system, so I haven't been able to actually physically spend time with them. So calling them, checking in on them, just making sure they're connected and taken care of has been like a big challenge over the phone, because I'm a very, very personable person and I need to be in physical space with people, and so, yeah. But it's been challenging, but nonetheless, I think we've gotten a lot of support. Destination Home has been great. The county, specifically, Supervisor Cindy Chavez's office has been great to us. And so we're just trying to navigate and, continue to serve youth in this pandemic,
Jen, Dante talked about the importance of partnerships and the challenges of navigating. Can you dive a little bit deeper into the COC, what that is, what your vision is for collective impact?
So probably a lot of folks on this are listening in or have been part of the COC, and what that stands for is Continuum of Care. And the way that came about was so think about like historically, and even to this day, like who's responsible for the issue of homelessness? There's no like Department of Homelessness at the, in the nation. So the de facto federal agency is Housing and Urban Development, HUD. I think they get like what, 3-4% of the entire federal budget, right? And in addition to all the public housing authorities around the nation, of which we have a housing authority, but every jurisdiction does, they also fund homelessness programs. historically, so when we kind of got into this, what I would say is about 8 or so years ago, our continuum of care was getting about $11 million annually from HUD. And that was really kind of the main source of sort of dedicated money. So the continuum of care was the network of agencies, mostly nonprofit partners, that would get those federal dollars and then execute. But what was missing was there was no sort of local strategy, no local leadership team or accountability structure. There is all these magnificent nonprofit organizations that are doing the work. I was working at this time, 8 years, prior to Destination, I was at Home First. So we had HUD contracts, we served people, we did our best job. But what was missing was a systems approach. So Destination Home was created on purpose to sort of be a convening public-private partnership. We were created from the city and the county, the city of San Jose and the county of Santa Clara. And the goal was to create a leadership structure locally. And so the Office of Supportive Housing did not exist at the time. For those of you elders, right? There was like the Office of Homeless Concerns, the office, I think there was an affordable housing department that made loans through the county. But so we decided if we brought the system partners together, all the big funders, you know, the city of San Jose, the county of Santa Clara, which is always going to be the biggest funder, and the housing authority. I don't know what to do about that. Sorry, I'm so sorry. I don't know how to make that be any quieter because I have all my windows closed. The county of Santa Clara, the housing authority, all together, we all joined hands and said, what would it look like if we executed on a true collective impact model? And what that means is a set of goals and strategies, which we have in the community plan to end homelessness. And we're actually about ready to share the next 5-year community plan to end homelessness. There's been a team of people working on this for the last year. So a set of strategies and goals and metrics, meaning we want to house this many people. We want to build this many housing units for homelessness. We want to prevent homelessness for this many people. So you have to have a way to measure, set a goal and measure. You have to have a data system that can track and make sure so we can see if we're meeting our goal, if we're able to, if we can provide continuous updates, course corrections, whatever. And we have to have a commitment from the funders to pay for the work. Because if you don't pay for the work, then how are the nonprofits supposed to do what they do best? So all of this was put together through our original community plan to end homelessness in 2015. And part of that was creating a leadership structure locally that would own this work over time. Meaning Destination Home could go away tomorrow, Health Trust could shift a mission and focus on something else. Nonprofits have flexibility that our safety net system really does not have. Our safety net system is responsible for homelessness deep inside its bones. So how do we make that system be responsible, be accountable, and lead and use the rest of us to help lead that effort? So the Office of Supportive Housing was created just a few years ago. Really, it's hard to believe, right? And Key has been the director, and we've been super lucky to have him because he does the things that builds trust. He does what he says he's going to do, right? What he was talking about before, which was listen and try to incorporate ideas. You know, he doesn't overpromise. Like, these things are really important because we need to trust our leaders to do what they're telling us they're going to do and hold us all accountable. So now, believe it or not, we have, and nothing's perfect, right? But we have a homelessness prevention system with 16 agencies that are all funded to the cost that they've asked for, right? To prevent homelessness for a set of families, which because of COVID is just, we could talk about that for hours, but like, right, is a system. There's a supportive housing system of which Health Trust and others are responsible for, where they are serving the hardest families and individuals to serve, people that need permanent supportive housing. And then there's a whole other suite of nonprofit organizations that are doing rapid rehousing, other types of services for families and individuals and kids that don't need permanent supportive housing. And the most important thing we did was we passed Measure A, which gave us finally a local source of money to build the housing that we desperately need. Santa Clara County is the only jurisdiction outside of Los Angeles that is deliberately building extremely low income and permanent supportive housing, is prioritizing housing, which is going to always be not only for the most vulnerable, people that are disabled or on fixed income with chronic disease, but also largely families of color, right? So when you think about this from an equity lens, building the deepest level of affordability is an equity strategy. So I don't know, Key should talk about this, but 26, 28 Measure A projects that are being built. Even during COVID, we've permanently housed over almost 400 people, in addition to all of the emergency things that have been happening. Only possible because there is a system with dozens and dozens of partners that are all working towards the same set of goals, and they're each doing their part beautifully, right? And to Key's point, like, are we doing enough? No. Should we be doing more? Yes. Do people complain, and are they right to complain? Of course. But most of the time when people are complaining about this isn't being done or you're not doing this, they're doing that from their armchairs. They're not doing it from being in this work with us. This is, it's no joke to open 6 mass shelters and hundreds of hotel rooms and a trailer park and permanently house 400 people in a global pandemic. And the number of people that are doing that is spread across a finite number of organizations that have been risking their lives every day and the lives of their families to walk straight into the middle of COVID, when many other people have had the great fortune to stay home. Sorry, that was a little extra at the end, but like, that's the kind of system and the kind of responsibility that we have to take if we're going to make a dent in this massive humanitarian crisis, because there are too many people that are going to want the community to do something else. Housing for tech workers, teachers need housing, firefighters need housing, and all those things are also true. But there's one thing in all of this that the market will never take care of. It will never respond deeply enough to the lowest income, most vulnerable people in our community. To get that across the line, you have to do that deliberately and forcefully. So that was a lot of talking. I'm going to stop.
I think you and Dante both point out the importance of relationships. And Key talked about how he has a close relationship with you and Destination Home, and you don't always agree. Key, can you talk more about, do you have secret rules of engagement or explicit rules of engagement to balance the advocates with the other demands?
Secret rules of engagement, probably not. I think the context that we have, though, is, when we're coming into a meeting, we're having a conversation, the context that we bring is that we're all trying to work towards a common goal. And we want, if we could do something, we will. And no one's, trying to, we have the same goal. And that's the context that Jen and I have and other people. And when people like any organization comes and talks to me, I assume and I feel like they are coming from a place of justice, a place of equity, and they're advocating for people, in terrible need. And so I want to do all those things. So the only thing that we ask is, sometimes we can't do it. Don't get mad at us. Just like sometimes our community-based organizations can't do something, or they won't, or they decide to do something else. That's okay too, because we all have to make decisions based on what's going on right now, but we are still moving forward together on this long-term goal. And so if we remember that, we're going to be really powerful, man.
How often does Jen Loving yell at you, and do you ever yell back?
She never yells at me.
Actually, that's mostly true, Key. We strongly disagree, though. And what I think has been so good about this public-private partnership is we both have really different roles, right? And we're not afraid to press on each other to be better. Key's the one who told me that we needed a a lot of private money to be able to make the Measure A bond work well. That was one of the things that he was pressing on us to do. One of the things that we press on him to do is, get as many Measure A projects into the pipeline as possible. These things all have to work together. That's the problem with massive, large-scale humanitarian things like food or water or housing, is that there's not one entity that can solve it, and there's not one entity that can just be this owner of it. So if you don't have partnerships and relationships and a willingness to be in on things together, you're not going to do what needs to be done, because no one can do it all. And that's been a fallacy for homelessness forever. Cities are not managing public health. They're not managing the safety net, but they're responsible for land use, zoning, development, what gets built, right? The counties typically are not responsible, right? Measure A has changed that a little bit, but not responsible for zoning, land use, right? Those kinds of policies, but they have all the money for the healthcare system and all these other critical human needs, So, and then you have the housing authority that it's almost its own jurisdiction that's over somewhere else, that is really the only federal conduit to all of the Section 8 or public housing that's available in any sort of jurisdiction. So if everyone has different pieces and they're not working together, then everyone's doing their own thing, which was historically true here and largely true in a lot of communities around the nation. Having a mutually reinforcing team of people that are working together towards the same strategies has meant that we have permanently housed over 14,000 people in the last 5 years. It's meant that we've been able to prevent homelessness for 1,400 families. It's meant that there are 20-something Measure A projects, and how many key already have people living in them, right? In that were funded, built, constructed, and opened in less than 3 years. That's some crazy renegade stuff that doesn't happen unless everybody is willing to work together and make it so that the elected officials can do the right thing. Meaning, as we all know, anytime we say we want to build something for homeless people anywhere, people lose their minds. We're trying to do a tiny home project in District 2, and it's wild, the opposition. But it's not unique, because we get the opposition every time. People are scared of homelessness. People have mythologized poverty. We've created a separatist reality about an othering for who is homeless. So there's this, because we have done a poor job in addressing it for decades. So people are scared, and they don't understand that the solution does not look like the problems that they see. So when it's time to say we can build 100 units or 200 units or however many units, we need elected officials that feel confident in the strategy and the services and the partners, in knowing that this is going to be additive and beneficial in their district, in their neighborhood, because frankly, it always is. Villas on the Park Path project was built on 2nd Street, right near St. James Park. It had required 100 or more meetings of fierce neighborhood opposition. But the council member, Raul Perales, and the staff at PATH and the city and the county staff stood together and managed those concerns. And today, that is the most beautiful project on that block. It is the most beautiful building on that block. And it's saving the lives of, 100 people and more, right? As things turn over.
Can I chime in?
Of course.
We got a private question about how do we advocate as key as the man. I just want to touch on that. First thing, one of the things that I value with the relationship that I have with Jen is that we're able to have the hardest conversations with each other and with those that want to be educated and informed about how to best serve the community. And a lot of times it's about, racial equity. But one of the first meetings one of the only meetings I've ever had with Key, honestly, he was different in the sense that I've been in so many meetings that so many people sugarcoat. They really don't tell it like it is. They kind of, they try to hold your hand too much. And he was very honest about what it is that I wanted to accomplish with raising the bar and solutions. You know, he actually came up with some solutions and some things that could potentially work. And so we still have to work on those things. I know COVID has been pretty, you know, heavy in everyone's, you know, life, but I think that's where I respect him as a representative of the government. Same thing with Supervisor Cindy Chavez. She's always been able to be very honest with me, especially behind closed doors. And for him, it was the same thing. His honesty and his opinion on how he sees things was most valuable to me. And so, you know, I think having partnerships like that, having people on both sides of the coin, you have to find a balance, and most of all, you have to be able to communicate and communicate effectively. And I think that's how you get some of the best solutions. And I'm still, you know, waiting on, you know, the chance to be able to partner with him, and especially with Destination Home, because I love Destination Home and everything that they stand for. But I don't see that enough. I don't see people having the hardest conversations enough. I don't see people being honest enough, like you just being brutally honest in the most respectful way. I don't see that enough, and it needs to happen, because if we don't rip off the Band-Aid, that wound is just going to continue to fester. We can, you know, Jen had said it already, we can continue to throw all this money at the issues that we have in our community, but if we don't actually understand those systemic root issue, you know, problems, it's never going to matter, you know. And so meeting more people, or having more people like Keely and Jen Loving in our community to serve this community is vital. It's super vital. I actually come from some of the roughest neighborhoods in San Jose, East Palo Alto, the places I've lived, and I just know that a lot of the people that, you know, organizations like Destination Home or the county serve come from some of the poorest areas, and a lot of times they don't have people really serving them and being honest with them the way that they need to, especially because they don't have a lot of people lived experience serving them. And so I just appreciate what these two individuals have done for the community. And I've only been involved as an organization for a very short time, but I can see the impact that they're making. You know, I hear his name everywhere. I hear Jen's name everywhere. And so their reputation, it precedes them. It really does, you know.
I really want to thank all of you for raising some hard topics in this conversation. I think one of the challenges of living in Silicon Valley is we like to think we're post-racial, or that, oh, we're so diverse, there's no racism here, but we see it every day in the housing and homelessness world. And I really appreciate you raising and lifting the notion of racial equity as a key thing that we need to work on collectively going forward. I want to invite Jen Terai from SVCN to chime in now. I think she has been gathering some questions from participants, and I'll turn it over to Jen.
Thanks, Michelle. Key has actually been answering all of the questions.
All right.
But I do want to just, you know, go over them out loud. So Key, I didn't tell you to not answer them, but just for all of our participants to hear, there was a question about whether there are any hotels in Milpitas in the Project Room Key program. Key, I don't know if you want to say anything more about that.
There are not any hotels that we're using in the city of Milpitas. We actually tried to use one, but that didn't work out for now. We'll circle back to it later on.
And then there was a question if there are any programs or services for homeless people in Milpitas. I think Life Moves is out there, aren't they?
I'm not aware of any specific shelters or day centers. Which site though in Milpitas?
I believe they might not have a site, but they provide services in Milpitas.
Right. Yeah, I think so. So there is a new question. Are there any Measure A projects in North County and South County?
Yeah, there are quite a few in South County. Gilroy Gateway, one in Morgan Hill just opened up. That was for like 36 or 40 families. In North County, I think we just funded a project in the city of Mountain View. I think that was an Eden or an EAH project. So we have some, and maybe I can send you the report that was sent to the board, and then maybe that can go out to all the persons who's tuned into this webinar.
Can I say that if people are interested in helping with Measure A advocacy and more projects, there's some exciting opportunities coming up. For example, in the city of Mountain View, we have something called Housing Ready Communities, and it's an advocacy effort that is part of Destination Home that does community organizing and bringing folks with lived experience, bringing neighbors together, faith-based community in order to advocate and push on projects. So when we know there's a project that's happening in a specific location, we have a group of people that are willing to help us work in the communities where they live to help bring these projects forward. So that's actually on our website. You can sign up, Housing Ready Communities, or if you're interested, email me and I will connect you.
Great. We have another question. Sorry, Michelle.
Okay,
We have another question that popped up. Let's see, if there were groups of nonprofits who wanted to create a cross-sector collective impact project, where would they start?
For what?
Like food distribution, perhaps?
You know, I think collective impact is a really beautiful way to address these big systemic challenges. But I've only seen it work so far in this community, really in homelessness. I think food is a great example. I think there's other things that could be a great example. I think that you have to start with the system partners, right? Because they influence a lot about how the work is at present. If the system partners and the system funders are not willing to flex, right, then that should be kind of the first, I think, scan of what's possible. And if that is an early roadblock, then you have to take that into consideration. Happy to talk with anybody who's interested in that. If it's about housing and homelessness, I would say there is one. And so if you're not plugged into it, we would love to plug you in. And our COC has regular communications and ways there's just even simple things like getting on our listserv that we can connect you.
We have another question, which actually is near and dear to my heart because I used to work with this community. But as we think about housing as healthcare and medicine, how can we ensure that the equity framework doesn't leave behind the needs of people with disabilities, especially people of color with disabilities?
I'm pausing because healthcare. I'm looking at Michele and Key for that one.
Key, I see you unmuted yourself.
Yeah, I mean, we're talking about housing, but when we're talking about supportive housing, the bulk of that is really what we call permanent supportive housing. So it is housing, deeply permanent, deeply affordable housing with ongoing services for individuals and families with disabling conditions. And that is the bulk of our work. Of course, there's an overlay of homelessness, a long-term homelessness with our supportive housing programs. But, you know, supportive housing is trying to correct or address some of those inequities. It is targeted specifically for people with disabling conditions. And, you know, among the homeless population, definitely people of color are overrepresented. And we did take a scan at our sort of enrollment by program. And I don't know if this is adequate, but you know, the number in our supportive housing programs, the enrollments, the outcomes among sort of broken down by ethnic group or ethnicity is proportional to their representation in the supportive housing, in homelessness in general. That's not sort of fixing the racial and health inequities of the community, of the society, but at least, you know, within our little box, at least we're not exacerbating it.
Could I say something?
Please.
Um, just being someone that actually has received permanent supportive housing, myself through basically HUD, and also working in, the field. One of the things that I would say is, again, a lot of the times the programs that offer these, they're understaffed. I know of a property right now where there are 4 or 5 HUD units for people that are getting permanent supportive housing, and it's constantly, even though they're not my youth or the people that I serve, constantly advocating for them on behalf of themselves because they're not getting the attention that they need being HUD clients. And so I think, again, just making sure that we can give the time. Time is a big investment for anyone. And a lot of times we sacrifice that for the name of, basically in the name of large numbers. Serving more people, I think, is very vital. But if you can't do it in an efficient way that is going to be helpful for that individual or that family, it can be, and in my opinion, it could be more detrimental in the long run. And Keely had talked about, for foster youth, for instance, we were talking about doing this longitudinal, not study, but services longitudinally for youth, and then collecting the data necessary and tracking how youth would be, achieving certain outcomes in a real intentional model. But you need manpower, a lot of time invested for something like that. And I think right now with permanent supportive housing, a lot of families or individuals think like, oh, I'm gonna get into this and I'm gonna have this potentially for life. And I'm gonna have the attention that I need to, be able to, to be able to survive or thrive in a community. And a lot of times that's not what we're seeing. A lot of times we're seeing people put in a situation, but they're honestly abandoned a lot of times. And there are a lot of good cases, but, even those few small cases that people aren't getting their needs met in those type of supportive programs, that has to be addressed. One of the things that is heart-wrenching for me is to see someone with disabilities, especially because I had learning disabilities growing up and my mother was physically disabled, is seeing people taken advantage of in many ways because they might not know how to advocate for themselves. And they're sitting here, just going through life without being able to basically live a life of quality. With all the resources that they have, they should be able to live a life of quality. And that's not the case all the time. So also having discussions about that and making sure that permanent supportive programs are funded to the point where they can actually, make room for the demand.
One of the things I'm really excited about is our local nonprofit Parents Helping Parents, who works closely with parents of children with special needs, has hired an advocacy person, not to do advocacy on behalf of everyone, but to really help build more advocates among the parent community. And it'll be exciting to see how that influences our work. We just have a few minutes left, and I want to close out the panel by asking each of you quickly, if there's a silver lining in the pandemic, how might that inform your work? And Key, why don't we start with you, and then Jen and Dante.
I think the piece for me is, I don't have the answer, but I feel like, I don't know if there's going back. This has exposed so much, or exacerbated, or exposed so many of the problems that were already in existence, and couple that with sort of the budgetary constraints facing local government organizations. Maybe the challenge or the opportunity is to reshape our small part of the world, and there may be both a necessity and a desire for all of that. So maybe we can pull some of these system-wide improvements, systemic improvements from this and carry them forward.
Thanks, Kate. Jen?
I think I'm going to answer that, Michelle, but I want to say something first, because the collective impact model that we've been talking about has allowed the city of San Jose and the county of Santa Clara to so quickly move into a joint operations for the pandemic, the reason that so much has been done, legitimately been done, is because Key and Jackie Morales-Ferrand and many others in both of those two departments quickly joined hands. And I just want to say, I have watched these folks work 7 days a week, 16 hours a day for 8 weeks. And, so while I wasn't surprised at watching them rise to the challenge and to do extraordinary work together, it made me feel like I was so grateful to watch and be a part of this. So first of all, so like when people are being critical, I would hold this field operations up against any community anywhere. The silver lining is it's allowed more to happen. There has been a persistent cry for more temporary and interim options that haven't happened, and those have happened. So I think the silver lining is now we have a lot more shelter capacity. The challenge will be, how do we hold on to it? How do we make sure that the people that have been temporarily stabilized are able to be stabilized over the long haul? And that is going to be difficult, because regardless of like what people think, the amount of money from the state and feds is not sufficient, right, for the operations, especially not in continuing those operations. And so I think there's an opportunity here. I also think buying the hotels, I think actually commercial real estate is totally going to change as some of the tech companies that are going to be able to make choices about where they want to do business. You hear them saying that they're going to go or they're going to work from home. That's going to change the real estate market. So those will be some opportunities too. I'll stop.
Dante.
For me, again, everything that I do based on my 30 years almost of life, being a part of public systems on a personal side and a professional side. Professional side for the last, 10 years. I think I'm not, and I hope no one takes this personal, I've said this many times, I'm not a big champion of public systems. I am, however, a big champion of people that work in public systems, for instance, like Keeley. I believe in people. And Jen just gave an example of him and another woman that work in, the sector, quickly mobilizing. It's people. It's not the system. They work for the system, but they mobilized and realized, hey, we have to do something for people. And so for me, the silver lining in all of this is it's gonna take people, and people that are willing to be courageous and willing to be vulnerable and put themselves out there for the better good of humanity, and understand that. One thing I believe is systems weren't created for people of color. They just weren't, not in a racial equity lens, they weren't. And so for me, it's the people that work in the system's job and the people that work outside of the system to collectively hold each other accountable to change that narrative. Because I know with the recent killing of this young man of color, it's been very emotional for me and my family. And like I said earlier before we got on this, I have 11 brothers and sisters, all young people of color. And it worries me because I'm in a space in my life where I've become college educated, gotten a degree, and been able to be influential in my community, serve my community. However, I still have young brothers and sisters that are going through very tough times. I live in Santa Clara, California, in a very safe zip code. They live in some of the worst war zones, if you will, in California. And so for me, it's just understanding that changing systems is all about changing people. It's all about changing the mind of, people that disagree with you on certain things, especially around race, and so that's why I love to have, colleagues like Keeley and Jen Loving. We're able to have the hard conversations and also educate one another. I don't know everything, and they don't as well, but collectively, we can make a very, very large impact on our community. We can change the lot, and I believe it in my heart. I believe the people that are involved in systems or in nonprofits can change the lives of thousands of individuals in our community. And I think once we understand that we need to mobilize, one of the biggest issues we've had in foster care, in the foster care community, is confidentiality, essentially, in agreements around not breaking that. And because you're working with minors and non-minor dependents, and it can be very challenging. And so once we get through all of the political and legalities of things, I think we'll start seeing the Silicon Valley, especially Santa Clara County, being a champion of real change that is going to be very important for the next generation to come, you know.
Dante, Jen, Key, I want to thank you all for being proximate, for advocating for racial equity and justice, and for the extraordinary work that all three of you are doing. Thank you so much. I want to turn things back over to Jen Tarai at SVCN.
Thank you all.
Thank you so much, Michelle, and to all of our panelists. I want to give everybody a round of applause. For those of you who are still with us, you know, let's all, if we were in person, we'd be clapping, right? So again, thanks to everybody who has joined us today. Thank you to all of our sponsors that I'm showing here. I think this was a very important conversation that is very near and dear to my heart. I know that for sure. And I was very moved to hear all of you speak today. I do want to remind everybody that next week we will have a session on empowering the community we pledge to serve. So some of what Jen and Dante were talking about earlier is going to be highlighted in next week's presentation. So come tune back in next Thursday for that. And then I just wanted to leave everybody with a list of who is on our SVCN cadre team. So we are a member organization. We are here to support the nonprofit community. Reach out to us for any of your needs. And if there are issues or topics that you want us to take a look at and address with the community, we are happy to do so. So on that note, I know that Michelle and Jen have a meeting to go to, and I think Michelle's leading that one. So we'll let everybody go. But again, thank you all for joining us, and have a wonderful afternoon.